Aiko, it appears on the report of the medical journal The Lancet that the Philippines ranked 66th out of 91 countries in terms of suppressing COVID-19 pandemic. What did our health department say about this?
Yes, Arlene, based on a study published on September 14 on international medical journal The Lancet, the Philippines ranked 66 out of 91 countries in terms of suppressing the spread of COVID-19. The ranking was based on the number of new coronavirus cases per million population per day. The Lancet COVID-19 Commission classified the Philippines as having moderate transmission with 37.5 new infections and 0.5 new deaths per million per day, and 8.2 conducted tests per case daily in August, and had a reproduction rate of 1.2 per day. Arlene, according to the medical journal, the Philippines has not suppressed COVID-19, particularly blaming the political leadership style or what it calls medical populism. It says that medical populism is simplifying pandemic by downplaying its impact or touting easy solutions or treatments, spectacularizing the responses to crisis, forging divisions between the people and dangerous others, and making medical knowledge claims to support the above. The study cited three presidents which it says are doing medical populism, namely U.S. President Donald Trump, Philippine President Rodrigo Duterte, and Brazilian President Jair Bolsonaro. The Lancet calls on governments to prioritize advice from the professional public health community in suppressing the COVID-19 pandemic. Arlene, the DOH has taken note of the comments, but says this will not hinder the government from playing its role to combat the health crisis. Here is Undersecretary Maria Rosario Vergere.
We always receive naman itong mga ganitong mga komento, no? There are rankings and then there are this specific comments. But ang sa amin, magtatrabaho lang kami ng tuloy-tuloy. Kami po ay sama-samang nagtatrabaho.
Meanwhile, Harleen, Malacanang has issued a statement saying that the Philippines has met the challenges of COVID-19 head-on, with science and hard data guiding the chief executive's decision and actions. Contrary to the medical populism, political leadership style issue raised by the Lancet, the palace adds that the Duterte administration has taken concrete interventions to reduce the spread of the virus. The statement also says that the national government's response is a whole of government and whole of society effort, where every sector from public health to economic has been consulted to ensure that the adverse impact of the COVID-19 pandemic is addressed through the National Action Plan. Arlene.
All right. Thank you, Aiko Miguel, reporting live.